If you're pregnant and planning to fast, you might have a lot of questions like, is it alright to fast while being pregnant? Is it going to affect my newborn? Or what should I eat if I fast during pregnancy? Hello, I'm Dr. Owais and I'm here to answer all of those queries and give you tips and suggestions important for you when you choose to fast while being pregnant. Let's clear your queries one by one. So, is it really alright to fast while being pregnant? Yes, you can surely fast while being pregnant. But you should adopt some lifestyle changes and take certain precautions to keep yourself healthy. So if you're a pregnant mother and are deciding to fast, the first thing I suggest you do is make a visit to your obstetrician or a doctor and get a detailed checkup and test to make sure you don't have diabetes, hypertension, and also if everything is going well with the growth of your baby. Now, most of the research and scientific papers shows that it is safe to fast during pregnancy. Next, I would advise you to stay hydrated. What is recommended is roughly 12 glasses of water, which is not easy, especially if you're feeling sick or having vomiting. So, how do you maintain hydration in such situations? Now, to help with your sickness or vomiting, you can add some flavor to the water, like having lemonade. Do not drink loads of water on an empty stomach. The space in the stomach is reduced as the baby grows. Instead, I suggest drink slowly in small sips so you can adjust more water. Okay, that's how you drink. But what about the diet? And so the question is, what to eat if you plan to fast during pregnancy? Well, you see, during pregnancy, you need to take certain supplements and sometimes medications and even higher calories to keep your baby healthy. Now, if you're fasting during your early 3 months of pregnancy or the first 3 months, make sure you're taking folic acid regularly. Folic acid is important for your baby's normal brain development. Foods that are rich in folic acid are the green leafy vegetables, eggs, nuts, broccoli, citrus food, which you must add in your meals. Now, for the next 3 months, you should be eating a lot of iron. Iron deficiency is very common in pregnant females. Foods like red meat, apples, red beans, and green vegetables all are rich sources of iron. Now, the child begins to develop skeletal system during these 3 months. So you should increase your calcium intake. Dairy products like cheese, milk, and yogurt are excellent sources of calcium. Now, other important nutrient that you should include is omega fatty 3 acid and also magnesium and vitamin D, which can be found in fish, nuts, yogurt, and eat a lot of citrus fruits like oranges, lemons, and kiwi that can provide you vitamin C, which will help in the absorption of iron in your body. Now, again, make sure you're drinking a lot of water because constipation is very common. Now, your last months of pregnancy require some extra effort as the baby is growing in size and takes extra space in your body. So you might not be able to eat a lot during non-fasting hours. But at the same time, you need to maintain a very high caloric intake. So how do you maintain calories intake? One way to do this is to break your food intake into small portions. Avoid overeating at iftar time. Whatever you eat, make small portions of the diet and do not try to overeat at once. This will not only keep your caloric intake up to the mark, but also let you have your meals comfortably without feeling full and bloated. Like I said, constipation is a major problem in late pregnancy. Try taking high fiber diets, for example, whole wheat breads, fruits, along with peels, salads, and vegetables to combat constipation. Finally, always keep a check on your baby's movement. Seek medical attention if you experience any abnormal delay in your baby's movements or activity. Lastly, if during pregnancy you are suffering with problems like high blood pressure or diabetes, I suggest you do not fast, as this may lead to problems in baby's health. Fasting is a personal decision, and despite its challenges, I admire new mothers who wish to fast. Truly, I believe they should be rewarded twice. Remember, your health and the well being of your babies should always be top priority. I hope this video was useful. Don't forget to like, share, and subscribe to my channel. And Ramadan Kareem.